Thank you, Troy. And thank you. Good evening, Mr. Chairman. It is a wonderful pleasure to see you here with that title around you. To be here in charge. And thank you, Troy. I'm honored, I'm blessed, and I'm still truly humbled to have the opportunity to serve you. And thank you, Troy. He asked me to bring you an update on the thing that has been put in as our stumbling block for this coming election. For any of you that have any doubt why we have the COVID out there, it is there because it's the Democrats' only path that they have to disrupting this election. And everything that's been done there has been designed to take what they thought was going to be a slam dunk, but we're turned out that we now are finding, and I hope it's not too late, that to call it a hoax is not truly, but it is a virus out there. But folks, it is not what it's made out to be. It doesn't need to be what it's out to be, and we have been fooled with this thing, and we have been led down what I used to call the primrose path, that we need to wake up. And I will say the good news is that I just learned that that group of doctors that I've been working with went to Washington today, had a huge press conference, and after an hour ago, their Facebook, I thought our Facebook post that it did over 200,000 in less than a week, and then one last Friday that did over 100,000 was doing good. Theirs this afternoon went over 6.6 million posts. What I wanted to do here is to give you a quick update, have you understand why the group I work with called Docs Don't Fear the COVID. Don't fear the COVID. And so, what happened here recently as it started to come to a head is that after several weeks of studying and reading and talking to doctors about what was going on, last week, when I was down in Houston, I had a lady tell me about her mother-in-law that got the COVID in late March, went to the hospital with one lung filled, the other half filled, got her to the hospital where they gave her hydroxychloroquine, azithromycin, and zinc. And 3 days later, the 82-year-old lady drove herself home from the hospital. Now, we couple that with a press conference in which our governor was asked about what did he see as the end game, essentially, that's a paraphrase, and his answer was, we won't know until we have medicines that we can treat this with. And then, the next day, the Texas Pharmacy Board announced that they were not going to renew their restriction on the use of hydroxychloroquine. As you recall, I had a real battle with the Pharmacy Board and got it relieved. Between those three things, I decided to put it all together and explain to people why they don't need to be afraid anymore. Because, unfortunately, the media has led everybody to believe that if you stick your head outside of your front door without a mask on, you're going to get the COVID. And if you get the COVID, you're going to die. Well, nothing can be farther from the truth. We've got something that has a 99.8% survival rate, and yet we're treating as though this was Ebola on steroids, and it's not. But in this, that prompted me to talk about other organizations that have come out and said what they think. And the American Association of Physicians and Surgeons, for those you don't know, there are two organizations, one called the TMA, the other called the American Association of Physicians and Surgeons. This is the conservative group. The TMA is the liberal left group. They're the ones that are fighting to keep the medicines from being used. AAPS, they sued the FDC. They sued them to allow the use of it. And as I read what they submitted in their lawsuit, well, I will come to that in just a minute there, but it came up with a chart that shows the difference between countries that treat with hydroxy and those that don't. And then we had a report that was put out in there that they simply said hydroxychloroquine has about 90% chance of healing COVID-19 patients. Folks, that's better than what we have with the flu or anything else out there. And then the Ford health system came out and they said the treatment with hydroxychloroquine, our death rate significantly in COVID-19 patients dropped significantly. This is Ford Health Systems, well known. And then we had a study that came out with Dr. Rich originally, and he said early outpatient treatment of symptomatic COVID patients can be treated by existing drugs. And the details were there. And then Johns Hopkins put out with the same author, the key to defeating COVID-19 already exists. We just start needing to use it. Folks, there is just too much evidence, too much out there being presented that says that we can do this. Now this is the chart that was in the lawsuit. If you look at it at the top are the blue lines. I know you can't read what's on there because it's really fuzzy here. Those are the countries that allow the use of hydroxychloroquine. The ones in red at the bottom, which the United States is part of, that's the death rate per million people. We're in the bottom group there. And what that chart tells you is that the death rate in countries that allow the use of hydroxychloroquine, it is 1/10 of what the other countries are. And if that wasn't enough, this chart, which is an ongoing chart, and I'll show you the links to these. This is a continuously plotting chart that's on the internet. That's up to, this is based on about 630,000 patients. Again, the red lines are at the top, are the United Kingdom, the USA, and other countries that don't allow it. Look at the bottom, the green lines. That is the death rate for those countries that do allow it. Again, they're very consistent between the two. And then this will be on my website so you can look at those for yourself. Now, what this means, and this is, some people would say what I'm about to tell you is not really very politically correct, but it's absolutely true. And so, we have had a huge number of deaths in Texas and the United States. Matter of fact, as of yesterday, the United States deaths are 145,982. In Texas, it's 5,038 people have died. Countries that allow the use of hydroxychloroquine have a 90% lower death rate. And what that means is, in the United States, had we allowed the use of hydroxychloroquine and the other treatments, we would have at least 131,384 people still alive today. And in Texas, 4,534 people have unnecessarily died because they were refused to allow doctors to use the medicines that would have kept them alive. They died unnecessarily, and what that is the FDA, the Texas Medical Board, Texas Pharmacy Association, the CDC, NIH, and Health and Human Services all have the blood of these people on their hands. That death count, to put in perspective, Texans killed by enemies versus Texans killed by Texans. Texans killed by foreign enemies. In Vietnam, we lost 3,417 of our warfighters in Vietnam. And by Texans killed by Texans in this, over 5,000. We do more damage to our country than our enemies do. Do you see a problem here? Yeah. And at the United States level, Americans killed by foreign enemies, In 9/11, we got really upset when there were almost 3,000 Americans killed by Muslim terrorists. But right now, we've had 145,982 killed by our rules and regulations promulgated by bureaucrats. Do you really see a problem here?
Yeah.
And why would we knowingly withhold medical treatment not be considered to be murder? You know, if you're, hypothetically, we're in a group of 3 of you got together and one of them said, you know, we need to rob this place. And I said, oh no, we don't want to do that. No, you don't have to do it. You just stand over here as a lookout. And you stand over here to drive the car. I'm going to go in and rob. Well, he goes in there. And it doesn't work out too well, and he ends up killing somebody in there. Do you know what you get charged with? Same murder. Those people who knew that this would work, but sat silent, just said, well, that's what they said in Washington, or that's what they said at the CDC, or that's what they said in NIH, we can't do anything about it. Those who did that are just as guilty as those who made it up. And that includes the people at the Federal Drug Administration, the Center for Disease Control, the Texas Medical Board, the Texas Pharmacy Board, presidential advisors, Texas Health and Human Services, and doctors and hospitals that refuse to use the medicines, and they have. I just had this past week, a very good friend of mine got a call that he had been tested positive at the hospital, sent home, told to take some Tylenol. Watch his blood oxygen level. He did. It got down to 92. He could barely talk, could barely breathe. He went back to the hospital, and they said, you're not sick enough yet. Go home and come back when you get sicker. I got him in touch with one of the doctors that don't fear COVID. The doctor told me, texted me and said, it's a good thing he got here. He was about 6 hours away from being in intensive care. Yesterday he called to tell me, I finally ate a hamburger. I felt so good. We have someone here tonight who went through a similar thing long enough ago that she is now outside the window of being contagious. Was about in the same condition. Tilly, would you like to stand up? This is a lady that was treated by one of the doctors. And she's here.
Can I say something, Doc?
So the question?
May I say something?
Sure, Kelly.
Thank you so much for those of you who prayed for me. It worked. And I'm standing here today because of Senator Bob Hall. My daughter called after I'd been sick about 5 days and lives in Central Texas and said, Mother, I'm packed, I'm coming up. She came up. I was sicker and sicker. She gets on the phone with my good friend Vicki Slayton. And between her, Vicki Slayton, and Bob Hall, they get me into Dr. Proctor and McKinney. I had had a telemedicine conference with my Baylor doctors downtown. He told me, you just probably need to go to the ER. Well, I knew months ago I would not be going to any hospital. And because Bob Hall called Dr. Proctor in McKinney, I'm 4 days out, I'm clear. I had a severe case. I didn't know what even was going on for 4 or 5 days. So, this is my hero.
I just did what any of you would have done if you'd known what I knew about it and had the relationship. I just carried through with it and was so glad. And Tilly was just one of several others that, thank goodness, I think we're close to the end of the charade on this. And the problem here, and I'm going to tell you why we have this, where we got to where we are, because the basic strategy that we went into this thing and was doing was a defensive strategy that does not work. We're not going to be able to read that. Basically, the defensive strategy is wear a mask, lock down, and isolate. It had no element in it of offense. None. And any of you who've been here in the military know that there's a place for defense. But if you're going to win, you got to have an offense. The defense just keeps you from losing. We didn't have that. And it had the only element of offense was hope. Hide in hope. And Ronald Reagan told us about hope. It ain't no strategy in there. And this is the only disease that we have that takes a wait and see, except for prostate cancer in old men. Other than that, if you go to a doctor with stage 1 cancer, are they going to tell you go home, take a couple of Tylenol and come back when you're stage 4, maybe we'll cut it out of you? No, but that's exactly what they're doing with this. And the problem we have is that once it gets hold of your body, if you don't have a good immune system, it will overcome it. And so by early intervention treatment, which is a change in strategy, where we win this with an offensive strategy, and that is we go after the enemy. And the enemy is the COVID. We don't just wait and see what it's going to do, and when it does its thing, bury the people in the end, which is what we're doing. We have it so that it's early intervention with existing drugs that are safe, they're effective, and they don't cost very much money. The estimate I've been given by multiple doctors is about $50 worth is all it takes to protect the average person. Given early, and that it works as a prophylactic, which means that it protects you from even getting the symptoms of it, much less likely to get them. Which means we don't need to worry about our kids going back to school. We don't need to worry about playing football. I had a conversation with a bunch of coaches the other day. We had a Zoom meeting, and they were trying to figure out what they put together in a plan so they could get back to playing football. And all the conversation, I'm thinking, you know, unless we go to tag football where you line up 3 yards behind the line of scrimmage and grab a flag, you aren't going to keep social distancing out there on the field. I know, I played a little bit in there. And so this is what will allow us to get back in school, because believe me, our kids need it. They need it badly. And all we're doing is sliding downhill every day with the problems that are rising. We have such an increase in the number of suicides out there. There's an airline, I lived with some airline pilots in the neighborhood, and as of 2 months ago, there had been 6 suicides by one of our major airlines right here in the Dallas area. Child abuse is up, domestic violence is up, automobile deaths are up, other kinds of deaths are all up as a result of what we're doing. Our cure right now is worse than the disease, and so it does have to change. We need to move on to an offensive strategy. And so where are we going to go and what are we going to do? I'm going to quote up here. It's credited to Bonhoeffer. Some people say he didn't really make this quote, but you know, it really doesn't matter because the words speak for themselves. And what it says is, silence in the face of evil is itself evil. God will not hold us guiltless. Not to speak is to speak, and not to act is to act. I've known about this for quite a while. It is part of what I am. And so when I learned about what was really happening, I had to speak and had to bring it out. But this has application as we move forward in what was said earlier. We have got to speak up, and we've got to act up and be active in this coming election. We have got a battle on our hands. We have an economy that's in turmoil, and it's going to be used against our president and the other candidates, and we're going to have to overcome that. And just pray that we're able to make this turnaround and move to an offense real soon. I hope this event that took place in D.C. today will get enough attention so we can. But let's talk about winning the November election battle, because it is a battle. It is a fight. We are in the fight for our life, for our children and our grandchildren. Make no mistake about it. If you have not been paying attention to what the Socialist Democrats have been saying out there, you need to start listening to them, because they're talking about a world that none of us want to live in. And so, in any battle, like what we had in World War II before Normandy, there was a lot of planning that took place for the logistics that was needed. It didn't just happen. It required an enormous amount of staff work and logistics. And we've had staff work and logistics in the Republican Party going now for the last 3 or 4 years, building the party up. We've had a lot of new registration and money being raised, getting ready. But now it's time for the battle. Now's the time to put the plans together to get into the fight, because we would not have won that battle without all that logistics being laid out. We've got the foundation for it now, and so it's time. It's time to hit the beaches, and now we move from planning to boots on the ground for the survival of our state and of our country, because we have got to win this. And the good point is that we now have a leader that understands the battle. And he understands it's going to be some hand-to-hand combat. And he had a phrase that I learned early on when he was being raised up by the Tea Party in Florida, and I was with the Tea Party here, and I listened to one of his first speeches to talking to people, and he let them know that it's time to fix the bayonets. That we are now in close hand-to-hand combat, and it's what it's going to take to win this, to fix the bayonets in charge. And I believe the rest of it was, if you're not going to do that, don't let the door hit you in the rear end on the way out of here, because all we want are fighters in this to fight to win. And so we see victory, just like what we saw before. And I don't know a better person to lead us to a resounding victory over the Democrats than my friend, Kay's friend, your friend, Texas's friend, our good new chairman, Colonel Allen West.
Come on, you guys can do better than that.